Hey everyone, how's it going? My name is Zach Courier and I am joined today by Dr. Pritha Dhungana. How are you doing today, doctor?
Very good, Zach. Thank you.
Absolutely. Thank you for joining us today, all the way from Claremont, Florida. You are the founder and medical director there of it's NeuroPsychiatry Center, is it
And
called?
Serenity Health Center. Yeah.
Absolutely. And you guys have blossomed from your Claremont location to 4 different locations. Now it's Neuropsychiatry Center and Serenity Health Centers, right? So
Yes.
your portion is kind of a dual thing there, yeah?
Yes. Yeah.
Awesome.
We started with Serenity first, and then we added the 2 additional centers, and because we had this really good novel neuromodulation treatment, so we added neuropsychiatry so that people are aware of that part.
Amazing, amazing. Tell us a little bit of your story. Wow, I'm sorry, I'm throwing this around. Tell us some of your story of how you got into the mental health field and how you came to start your own practice there.
So I'm originally from Kathmandu, Nepal. I did my med school there. And when I came here, and obviously I was just a frazzled medical, graduate wanting to get into residency and, focused on taking my boards. But all of a sudden, I had my first child, my son, and I feel like everything changed after that, completely my priorities and my awareness that every little interaction or any activity that I do with my son will later form mental impressions in his life and create experiences that'll shape the way he behaves in society and everything, And so I got really interested in child and adolescent psychiatry and started doing my research with Dr. Regina Bussing, and she's the chairman at the University of Florida, Gainesville, and she's the so-called guru of ADHD. And during that time, I came in contact with families who were just like, overwhelmed and frazzled, not knowing how to deal with their children, not because they were not smart, but they had some sort of learning problems or attention problems, and that would lead to behavioral issues and negative interactions with the parents. So that got me really passionate about child and adolescent psychiatry, and that's how I entered the field of psychiatry and mental health. And I'm really passionate about this and, just love this field.
Excellent. That's very cool. Now, this has been a wild year, obviously, with dealing with the global pandemic, lockdowns and things like that. I know you guys had to shut down for a time, and you've probably done a lot of pivoting to telepsych and things like that. But what are some of the things that you're seeing this year? And maybe a 2-part question. What's some advice that you've been readily doling out for people that are struggling with this all things 2020, really?
Yes, and see, and of course, Zach, that depression is a major problem, amongst people nowadays. Anxiety, depression, and also I see a lot of fear of the unknown, fear of the pandemic, fear of the social unrest, fear of politics. I mean, there's so many things, and, bombarding young minds through media, the social media, and just, them being cooped up at home, not having any social outlets. I see a lot of fear, and that is translating, it is coming out as either somatic symptoms, headaches, stomach aches, children being rushed to ERs, adults, I mean, leave alone children. But a lot of that's what's ailing the community, I feel, at this time. It's more fear-driven, and it's coming out as anxiety, depression, and a lot of social difficulties, coping, and a high rate of young people losing their lives, committing suicide.
No, I mean, that's a serious thing, obviously. Suicidal,
very sad.
Suicidal ideation. And what is your protocol for when someone comes to you with high suicidality, right? And you need to act fast. What is protocol for that typically for Serenity and
of course, we have questionnaires and screening questions. And then, our first advice obviously is, listen, we are an outpatient center and we're not a crisis center. So of course, if the parents or the person feels unsure about their safety, we encourage them to go to a crisis center at first. But if not, and as we talk to them, we do a lot of screening, and our staff, the amazing group of people, they love their job, they love what they're doing. They do a lot of screening, and then they get them in. And like I was telling you, a lot of times when we talk with people, we realize that it's not suicidal intention that they're having, but a fright, overwhelming frustration, and they don't know how to express it, and they just say, oh, I want to kill myself. I feel like killing myself, hurting myself, So that's a protocol. And then, we make my partner, Dr. Lal, and myself, we see the initial evaluation of the patient, and we form a treatment plan. And then we have really well qualified psychiatric nurse practitioners who help us with the follow-up. And so we make a little biopsychosocial sort of a format for the treatment plan and say, for the chemical part, what can we do? And we advise them to pay a lot of attention on the nutrition, hydration, sleep hygiene, because that makes a huge impact in our well-being, And then we try to give them the right medication if needed. Some people have been through that route before and, are not doing good with medications. Then we suggest TMS for them, the different types. And then we also have Dr. Claire Edwards, a clinical psychologist, who, does psychoeducational testings, does advanced forms of therapy such as ERP, DBT, CBT, to help young people cope and not self-injure themselves. And then we also pay a lot of attention in parent management training, bringing the family members in to educate them about the person's condition and how they can be of help and not make the situation, worse. So that's how we deal with a person's problems. And we are really big proponent of, lifestyle changes and developing coping skills because, the medications can help only some, right, Zach? But ultimately, the young people mostly, they just need to learn that they have the power within themselves to do well. It's just like we need to guide them to reach that, the trust and faith in themselves, not be afraid to feel better, not be afraid to seek attention and help, not be afraid to make changes in their coping style and, in their social setting and feel better in the process, So that's the way we function here. And we're completely against benzodiazepine. We don't even prescribe Xanax, Adderall, all those addicting, habit-forming medications. And I know they have a role, very limited in very short-term times, if there's an acute crisis. But sometimes many of the providers forget to take the patients off these medications for years. And, they become dependent on it without realizing that, So we've gotten so many people out of benzodiazepine, I can't even tell you, it's amazing.
That
it's
is
very gratifying.
It's so habit forming, right? And especially without the accountability of our people
Absolutely.
staying on top of this for sure.
And it's very easy to prescribe and get people hooked on it, but look at the consequences, the negative, cognitive dulling, young people can't focus, older people, they get more depressed. And, you cannot get off it eventually, So now they've developed the e-force. I don't know if you've heard of that, which is good because that's the government in connection for all the providers that we check to make sure that they're not going from different practices and getting controlled substances. That's been really helpful to track people and the prescriptions.
Obviously, there's, with things like our opioid pandemic, like that, right? I mean, there's obviously been a serious crackdown. Now, I wanted to pivot a little bit to TMS because that's something that you guys offer. You have, multiple machines there and are able to help so many people in Central Florida. Again, you decided to not just do the med management, right? And you have a holistic way of working on things. But with something like TMS is typically treating severely depressed people, right? And where
it's moderate to severe, Zach. It's not if they're extremely, sorry, I didn't mean to interrupt you, if it's severe depression or it's psychotic symptoms, then they need to go ECT, even though it's got all its negative, adverse effects, is very effective and very fast, So TMS is more for chronic, moderate to severe depression, which is just limiting you from functioning, and so it's more of an outpatient treatment. It's non-invasive. And the only thing that I find people, complaining a little bit is the time duration, because it takes 6 weeks of 5 consecutive days treatment.
Sure. Yeah. But they are pretty quick treatments, as I understand.
Very, yes.
Yeah. So it's something people can still manage with a work schedule, right?
Absolutely. No lifestyle changes. Like some people come in their lunch break. Some people come after work, and they don't have to. In fact, we encourage them not to make too many medication changes during the treatment, because we want to know what's causing what otherwise,
Sure.
So
maybe you could give us one example of someone who's come through TMS treatment, right? And what to expect. It's a little, we talked offline, right, about how there's an education piece missing there, where it's telecranial magnetic stimulation. So we're using a kind of an MRI type thing to stimulate part of the brain, and that's going to help fix our depression. How have you seen that manifest itself in some of your patients?
So some examples of how they've benefited. And again, that's what you're asking, right?
Yeah,
of how patients have benefited. And so, we have so many stories, but two come to mind really, because there was a lady, and she's 68 now. And she tells us, and she's featured in many other articles with us regarding TMS and her treatment in our center. So she struggled with chronic fatigue syndrome for years, since she was 48. And she's been on several medications, literally thousands, right? And so slowly she was extremely tired and frustrated, and she lives in the villages, in the retirement community. So we started TMS treatment for her. And now she's off maybe she's on one SSRI. And she tells us that she feels better at 68 than when she did at 48. So that's one age thing that she's done amazing. And then we've also had one of a young person, I guess, young boy, and his mother is a nurse, and I was treating him for ADHD and depression for years, since he was almost 8 or 9, right? And so he was in his senior year last year, and really unmotivated, didn't want to take medications, not wanting to go to college, graduate. And, lo and behold, suddenly he turned 18, and we were able to get authorization for the TMS. And he got that during the summer, and his life has changed. His mother is a big advocate of that, and she goes around in the community to say how his life has changed. And he's in college now. He's so happy, he's socializing, and he's not on any medications. So this is amazing kind of stories that we have.
That is so wild. Yeah. And again, it's with the lack of sort of education there, and most people don't know about it. It is really great to see, you've been doing this for years now.
Yes.
At multiple centers, and like you said, you've had countless stories and been able to share these where even someone who is an older person, right? You think, maybe their mind is set in their ways, and that's, that they're beyond help, right? A 68-year-old woman really getting a new lease on life, saying she feels better than she did 20 years ago.
Yes.
So I think it really speaks to the fact that you guys, you know what you're doing, and you're dealing with these mental health issues, right? You might as well seek out some professional help, right? We always ask that question of when do you suggest that people actually do seek out professional help for what they're dealing with?
And again, like everyone has told you before, obviously we all can have traits, like, you can have a bad day, I can have a, good day. We're humans, so, but that's not clinical depression or anxiety. So I always tell people, when it starts affecting your functioning and yourself the best, right? And always I hear people saying, I don't feel like myself. This is not me. I'm fighting with my husband or with my spouse, or I'm getting irritated at work and I'm not functioning, and that's not me, And so that's when and we urge people, get help. It's not a big deal. We don't live in the dark ages. We live in this age of neuroscience, when there are so many options for you, and you can get your life back. You can start feeling like the person you are. So that's when we ask people, seek help. Don't wait. Don't say it'll go away. You know, if it's happening more days than not, you know, and if it is completely disrupting your work, your studies, academics, and young people, your social interactions, and also, you know, you don't have to wait till you get those negative self-harm thoughts. You can prevent it even earlier on and, you know, seek professional help.
That is amazing. I think that's the commercial right there.
Yeah. Thanks. Yeah, because I'm really passionate about mental health and neuropsychiatry and health in young people. You know, and the youth that, you know, that is going through so much right now.
Right. And even, you know, just on the, when we talk about interventional therapies, right, how we're just on the brink, right? I mean, this is 2020, it's a new decade. It's certainly this year, more than a lot of years, a big onus has been put on mental health, right? And maybe that stigma is being lifted because more and more people are thinking about that and how to stay healthy, you know, from a brain point of view, right? Well, Doctor, we really appreciate you having you on today, you know, being able to give us some of your story and your advice. Any last thoughts that you would like to leave us with today?
Again, you know, I just want to tell all the people out there, including my own children, the young people who are struggling with all anxiety, depression, and fear, don't be scared. Don't be scared of feeling better, and don't be scared of being your own leader and looking inward towards your own self to find that solution. And we are around here to help you, you know, to coach you and to provide that extra professional support. And that's why I urge everyone to get help if they need to, and just have your good, nice, and peaceful life, I guess.
I love it, right? Yeah, you only get one, right?
Yeah, you only have one, yeah.
Well, thank you so much, Doctor. Keep up the good work out there. Stay safe. And yeah, you're doing a great job. We appreciate it.
Thank you, Zach. And thank you for talking to me.
Of course.
Take
care.
Bye. Take care.